What if I told you that 1 in 5 hospital beds across the Illawarra Shoalhaven is unavailable to people from the community when they need it because it is being occupied by a person who is technically homeless? What if I told you that the equivalent of 7 hospitals across New South Wales are unavailable because they are being occupied by older people or people with disability who don't actually need hospital treatment, but who are unable to leave because they can't get the residential care that they need? Every day across New South Wales, people with disability and older people are living in hospitals because they can't get the care they need, and this is what we call bed block. And bed block is a whole of community issue. It doesn't just impact those people, it impacts everybody who needs hospital care. I'm Nikki Sloan and I'm CEO of Community Industry Group. I'm coming to you today from the beautiful lands of the Dharawal people. Welcome to Community Matters, the podcast where we dive into the heart of community solutions with the people who are making a difference. Today I'm really pleased to be joined by Margot Mains, who is the CEO of the Illawarra Shoalhaven Local Health District, which henceforth I'm going to call ISLID because it's a mouthful.
Sure is.
Margot's responsible for the important organisation which provides health services across the Illawarra and Shoalhaven, and that is health services to about 400,000 people. It's a major job, and I'm really grateful, Margot, that you're joining us today.
Thanks, Nikki. Thanks for having me.
So, Margot, I briefly outlined what bed block is. Could you help our listeners understand the scope of the issue and what makes it important and a challenge in this community?
Thanks, Nikki. And for our community, it's really important from a number of angles. First of all, for our older people, it has a real significance when they cannot get access to the services that they need, either to remain in their own home and be fully supported, or because they can't get into aged care facilities in a timely way. And that has a huge impact for people. So people are staying in hospital a lot longer. So on average now we are seeing older people who are awaiting placement or community support waiting for 66 days in our hospitals. Initially, they're waiting to get through they're there to be treated for their acute illness, but then they await assessment for aged care and aged care packages or aged care facilities, and then they are awaiting for those becoming available. That's a long time. And during that time, we see at times these people can decondition. So that means they can lose muscle tone. They're not as active as they would normally be. They're in a very busy acute hospital wards, so they don't walk as much as they do. And deconditioning can have a significant impact on people in terms of their physical physical health and ability to be able to actually go about what they need to be doing. The second real impact that we notice, and it's also particularly for our community, is that we provide a lot of acute services for our community, whether people are medically unwell or have a heart attack or have respiratory illness or they're involved in trauma, they need to have surgery or urgent surgery for a variety of conditions. And what actually happens when you've got people staying longer in hospital, and we have to remember that the people staying in hospital because they're awaiting facilities and beds is so much longer, that reduces the beds we've got available for our acute services. So what actually happens is then we start to get a backup through the process. So if you've got more people in hospital beds and you can't move, the equivalent of 2 hospitals at the current time, the equivalent of the full of Bulli Hospital in Coaldale, then we actually can't get movement out from Wollongong to Coaldale into Bulli, and then we start to get back up. So what actually happens is then people come to our emergency departments and they get assessed and treated. And some days we will start with up to 40 people in the emergency department are waiting to get into beds because they need beds. They've been assessed as needing beds. So then what you do, you've got a very busy ED because half of your department is consumed with people awaiting beds, and people are still coming in the door, and our population's growing, and we're ageing, and we are seeing more people presenting. So what actually happens is then the ambulances arriving can sometimes have difficulty bringing patients in from the ambulance into the ED until we can find spaces for people. And that creates an issue sometimes for ambulance services, because it means we can't get the ambulances back on the road where the community actually need them for high priority calls. We also have the impacts with reduced beds is that we also have to cancel things like elective surgeries. So we've been doing reduced elective surgeries, and we've been needing to outsource elective surgery into the private sector. So there's an impact overall for people who are older, and there's an impact for anybody in the community who's coming in for acute service delivery or for elective planned surgery.
Wow, that is a real concern for the whole of community. You mentioned that older people were in hospital for 66 days on average. What would a normal person from the community usually be in for?
So a normal average stay in hospital is about 4.5 days. For our length of stay is normally 4.5 days. Now, you would expect as people are older and more complex, they have more illnesses, we call them more comorbidities, that they will stay longer, but the length of time has significantly increased. So we used to, pre-COVID, have up to 30 to 40 people at any time waiting in hospital for aged care or home care packages. We reached a peak of 154. And if you top that on top of the fact that people are now staying far longer because there isn't the beds to get to or the packages in a timely way, that creates a huge challenge.
Yes, so the average person stays 4 days, an older person on average 66 days. That's about 16 people who are missing out on a place while that older person's in hospital. And if there's up to 154, that's 16 times 154 less beds available. That's really significant across 400,000 people population. That's amazing. We have heard, and it certainly sounds like it, that this area's had the worst bed block in the country. Why do you think that that's particular to this region, and what are you doing and the ISLID team doing to address the challenge?
Oh, heaps. So look, it's come about, I think, from a variety of factors that have actually happened and built up over time. One is our population is growing. So we have grown between the years 2016 to 21. We grew our local population 7% compared to the state average of 4%. We've got a compound population growth at the moment that's 40% higher than the state. We have a higher ageing population now living in our area compared to the rest of New South Wales. So we are at 5.7% of people over 80, where the state is at 4.8%. So we've got the culmination of population growth and ageing. However, we've also had some factors evolving over many years. So there has been a closure of 600 aged care facility beds in this district because often, for example, the beds were not appropriate to the type of population that we've actually got now. And also I think there's been a lack of planning and investment relative to what the demand is. So currently the supply of aged care facility and packages is not meeting the demand that's actually occurring in our population. So we have very much been doing, as I said earlier on, heaps of things. And I really want to make a call out to the ISLID teams, because without them we would not have been able to manage what we've been able to manage, but they have been absolutely phenomenal. So we've had to set in place a lot of new services. So, for example, we set up an aged care outreach service, which has meant that 3,000 people have now been seen, assessed and treated in aged care facilities by a comprehensive multidisciplinary professional team, which has meant they haven't needed to go to ED. 2,500 people as a consequence of that 3,000, nearly 80%, have actually been kept out of hospital. 500 have needed to go in. That is an amazing service because it is better for people to be cared for in their own home than it is in a hospital facility, if that's what can actually be done. On top of that, we've been adding surge beds to all our wards, and I have to thank the staff because they're coping with increased pressure in each of the wards. And we've added, for example, at Wollongong, some days up to 47 additional beds and surge beds, 10 additional beds at Bulli, and so on. We've also, through the working with the Commonwealth and State, have been able to open up a transition care facility, which has meant that we've been able to find 24 beds that people can go into and await for transition to aged care. We've also been working with the Commonwealth and have fortunately received some additional home care packages, which we're really excited about. But we've also been using virtual health and virtual hospitals to be able to monitor people in their own home where it's possible. So I think what we've done is brought together a whole range of things. And also we've been working with private hospitals who we've gained access to beds with also that we can use to transfer people into when we're short. So it's really been a whole range of approaches that have enabled us to try and best manage this so that community have the access that they should have.
And it's so complex. I think right at the start you talked about the 600 bed closures in aged care, and I think we've seen aged care become a market system, and it kind of indicates market failure. So I am going to explore aged care from a provider's perspective as part of this series with Mark Sewell, who you know very well, I know, and really see from an aged care perspective what's impacted that. I think the strategies that you're doing are fantastic, and the ACOS team, that being able to have older people treated in their facility, I think it points out a really important thing, that aged care isn't a medical facility and that they don't have all of those doctors there on hand. So partnering and being able to get doctors to them is a fantastic strategy, and I really congratulate you and the team on the strategies you've done.
Well, I think partnering is really crucial, and we learnt that through COVID because we made a call collectively together here that we wanted to work together for the benefit of our older people, our aged care population. And so when we were going through COVID, of course, aged care facility, people in aged care facilities were significantly impacted, particularly in the first round, and so were hospitals. And we worked together every day, and I think those relationships that we built have been really helpful for what we are now facing here together.
Oh, fantastic. Well, one good thing came out of COVID. So right at the start of the podcast, I pointed out this is not just an Islet issue, it's a whole of community issue. In an ideal world, what would you like to see that could make a real difference? And is there anything that members of the community could be doing to alleviate the problem?
Look, I think in an ideal world, it's a world that we work very closely with our communities. We harness the energy of agencies, of community groups, of providers, of consumers, and our community advocacy groups and councils to actually look to the future about what the future requirements actually are for an ageing population, because we are definitely have a significantly developing ageing population in our district. And what I would love to see is some really good planning around what is really needed in the next year, the next 5 years, the next 10 years, so that we make sure that we plan for services that are actually going to best meet the needs of our community, whether it's how we support people in their own homes to be the best that they can be with the care that we can, the support we can wrap around them, or how we actually make sure we have the supply to meet the growing demand that there is also for aged care facilities. And I think it's from the collective effort of people working together that is absolutely crucial. I really truly think that it's groups, Nikki, like what you are leading with Mark, and that with the community industry group is one of the most positive ways forward for any community, because in it you bring together all the key players you are very much close and connected to the community and understand, and you can lead, and you lead and help us with the planning and the advocacy about what's going to be best to make sure that our community gets what it needs and what it deserves moving forward. So the role that you play, the advocacy, the thing you brought together gave me real hope through this process, because everybody is connected and trying to really do things together to resolve the situation that we're facing.
Oh, well, thank you, Margot, for the compliment, but it's really not about us, but it is, as you say, it's about the collaboration.
And can I just also add one other thing? Through the work that you and Mark have been leading, we've had this amazing STARS group that's been established. And the STARS group for people is a group of really passionate people who have considerable experience in aged care, who are connecting with people as they're making really significant decisions in their lives about where they go to next. And it's a huge decision for the person, but it's also a huge decision often for carers and the family. And what they've been able to do is to sit down with the person and also with the family and actually help them make some decisions about the next steps of their journey. I cannot thank them enough from all of us, so thank you.
Wonderful. And we will actually be speaking with the coordinator of the STARS program to explore a little bit more about that program, but about the impacts on the older people and their family. But I think you've pointed out a really important issue for anyone who's feeling a bit frustrated about those older people who are in hospital for a long time, that they are making a really life-changing decision about where they go next. And I'm glad that you pointed out the emotion and the consideration that has to go into that.
Yeah. Look, I truly think it's probably, whilst we talk about the system changes we need to make and we talk about the community changes and what we all need to be doing to make things in a much better situation, it's also, I think, we all need to reflect on what we need to do to get ready for ageing and start thinking about that journey and what it is. And it's not easy. It's a complex journey, and it has some very significant personal decisions and family decisions in it. And I think one of the things we all need to reflect upon is what we do in moving forward.
I think that's a very good point, because I think we all tend to think that we're all just going to keep going as we are forever, and the reality is we need to plan for the future. Yes. Finally, Margot, this podcast is called Community Matters. Could you tell us about a person or people in this community who matter to you?
Well, I've already talked about the community industry group and how I think it's really mattered to our community. I want to talk about Val Fowle. Val Fowle is a very well-known woman in this community who's been an incredible leader and continues to be an incredible leader and advocate for aged care, and particularly for people with dementia. And I've had a lot to do with Val over the years that I have been here, and I know she's played a lot of significant leadership roles locally but also in Canberra. I had recently have met with Val, and that meeting had a profound impact upon me, because here you see a leader and an amazing advocate having an experience in one of our hospitals, and she was sharing with me her experience, and what was going through my mind after I had listened to her was how much her experience was shaped by what was happening within aged care and the whole demand and flow issues, but also and the need for appropriate services, but also the impact it was having on our hospitals had a huge impact on Val's journey. I had a profound impact. I'd like to see us be able to make a real difference for the people like Val. Val has fought for this community for many, many years, incredibly passionate, and I'd have to say I didn't like hearing her story because it was a result of the things we're talking about today.
Wow. I have to agree with you. Val is a real hero of mine. I think we've all got so much to learn from Val, and actually we're keen to have a conversation with Val, because she's got some great wisdom to
Yeah,
share.
she does. Yeah.
Thank you for calling her out. And thank you so much, Margot, for coming in and explaining this really complex issue and the impact on our community. I just want to say a big thank you to you. I think you've got the toughest job in the whole region, and I just want to thank you on behalf of the community for the work that you're doing and the work that the whole of the ISLA team are doing under really, really challenging circumstances.
Thanks, Nikki, and I just once again would like to make a call out to my team, because I do think they do an amazing job. They're wonderful to work with.
They sure do. So thank you for tuning into Community Matters. Don't forget to subscribe, to like, to share, to get this episode out, and to stay tuned, of course, for more stories of innovation and of community. Until next time, Community Matters.